And I'm Janae, and we're going to talk about the nervous system.
So what exactly is the nervous system?
Thing about the nervous system?
Yeah,
What's it do?
about the brain and the body movements, and
No. What the nervous system does?
Yes.
What's it do?
Well, it gives you feeling. When you see a girl that you really like, it makes you feel right here. So you buy her flowers.
Anything about the nervous system?
I know that it is a messaging system for your body, so it lets your brain know if there's anything wrong.
The nervous system is the master controlling and communicating system of the body.
This is a picture of some, well, if not all, the structure of a nerve. As you can see, there's many different parts to this. Right here you can see the nerve itself. We have the endurium, which surrounds fibers. Then there's the epineurium, which binds the fascials together to form a cord-like nerve.
Here's a word from our sponsor about nerve impulses.
A nerve impulse is an electrical current that travels along dendrites or axons due to ions moving through voltage-gated channels in the neuron's plasma membrane. Voltage-gated channels open and close in response to an electrical voltage, so they are affected by changes in electrical charge around them. When a neuron is at rest, a charge difference is maintained between the inside and outside of the cell. This charge difference is produced and maintained largely by active transport using sodium-potassium pumps. The pumps send sodium ions out of the cell and bring potassium ions in. While other channels allow some flow of potassium ions back out of the cell, the sodium ions cannot easily get back in to replace the lost positive charges. The overall result is that the exterior of the cell has a net positive charge and the interior has a net negative charge. The difference in charge between the interior and exterior of the cell is called the resting membrane potential. A nerve impulse begins when a stimulus disturbs the plasma membrane on a dendrite, causing sodium channels to open. Sodium ions flow into the cell, lessening the charge difference at that location. If the change is enough, it will cause nearby voltage-gated sodium channels to open. This allows so many sodium ions to flood into the cell at that location that the membrane there is depolarized, with the local region inside the cell having a net positive charge and the outside of the cell having a net negative charge. This affects neighboring voltage-gated sodium channels, which then open, moving the depolarization along the membrane. This moving depolarization is called an action potential. Changes occur behind the action potential to restore the resting membrane potential. The voltage-gated sodium channels close and voltage-gated potassium channels open. This allows a rapid flow of potassium ions out of the cell, repolarizing the membrane so that the inside is again negative and the outside positive. This is followed by use of sodium-potassium pumps to fully restore the resting membrane potential and to reestablish proper concentrations of sodium and potassium ions inside and outside of the cell.
What he forgot to mention was the transmission of the signal at the synapses, which is the process by which information is communicated.
Like wires in our home's electrical system, nerve cells make connections with other circuits called neural pathways. Unlike wires in our homes, however, nerve cells don't touch, but come close together at synapses. At the synapse, the two nerve cells are separated by a tiny gap, known as the synaptic cleft. The sending neuron is called the presynaptic cell, while the receiving one is called the postsynaptic cell. Nerve cells use chemical messages with neurotransmitters in a one-way direction across the synapse from presynaptic cell to postsynaptic cell.
So, Janae, do you know any disorders of the nervous system?
Yeah, where there was Bell palsy, it's a form of neuritis that involves paralysis of the facial nerve, causing weakness of the muscles of one side of the face and an inability to close the eye.
Why?
What?
Why?
Well, it's unknown, but recovery can occur spontaneously. Pregnant women and other respiratory infections can cause it.
When does this happen?
In pregnancy, and after the first week of giving birth.
What are some symptoms?
You can get paralysis of facial nerve, weakness of muscle on one side of the face, and you can lose your taste sensation. So, Tessa, what about cerebral palsy? I heard about that. Do you know anything?
Cerebral palsy is a non-progressive disorder of movement resulting from damage to the brain before, during, or immediately after birth. It's often associated with other neurological and mental problems. There are many causes including birth energy, hypoxia, and hypoglycemia. It can cause sensations, lack of balance, posture, and speech impairment, and epilepsy.
Myalgic encephalomyelitis is a condition characterized by extreme disabling fatigue that has lasted at least 6 months and is made worse by physical or mental exertion. It's unknown how you get it, and it often occurs as a sequel to such viral infections as glandular fever. Muscle pain is common. You can get some weakness, poor coordination. You can get some joint pain. You can have a fever and some sore throats.
Parkinson's disease is a degenerative disease process associated with aging that affects the basal ganglia of the brain. It causes tremors and poverty of spontaneous movements. It's more often in older men, and the cause of it is unknown. Oh, no, it's not.
But then there's cessation, okay? And that's a common condition arising from compression or damage to a nerve or nerve roots. It is caused by degeneration of intervertebral disc. You can feel pain down your back, your thighs, your legs, your feet, and your back is stiff and it's painful. And you can get numbness and weakness, and that's just not good.
This picture shows there are 12 cranial nerves which serve the head and the neck. The olfactory is purely sensory. It carries impulses for the sense of smell. The optic nerve is also purely sensory. It carries impulses for vision. The oculomotor supplies motor fibers to 4 of the 6 muscles. The trochlear supplies motor fibers for 1 external eye muscle. The trigeminal conducts sensory impulses from the skin of the face and mucosa of the nose and mouth. It contains motor fibers that activate the chewing muscles. The abducens nerve supplies motor fibers to the lateral rectus muscle, which rolls the eye laterally. The facial nerve activates the muscles of facial expression and the lacrimal and salivary glands. Vestibular cochlear is purely sensory. Vestibular branch transmits impulses for the sense of balance. And cochlear branch transmits impulses for the sense of hearing. The glossopharyngeal supplies motor fibers to the pharynx that promote swallowing and saliva production. It also carries sensory impulses from taste buds to the posterior tongue and from pressure receptors of the carotid artery. This is the vagus. Fibers carry sensory impulses from and motor impulses to the pharynx, larynx, and abdominal and thoracic viscera. Most motor fibers are parasynaptic, fibers that promote digestive activity and help regulate heart activity. The accessory nerve is mostly motor fibers that activate the sternocleidomastoid and trapezius muscles. Alright guys, I know you're tired, but this is the last one. The hypoglossal. Motor fiber control tongue movements, and sensory fibers carry impulses from the tongue. So yeah, you're probably wondering how people figured this out. When figuring out which cranial nerve affected the sense of smell, they had someone sniff and identify aromatic substances like oil and vanilla. They know this because fibers arose from olfactory receptors in the nasal mucosa and synapse with the olfactory buds. For the optic nerve, they had someone take an eye chart test. For the hypoglossal nerve, they asked people to stick out their tongue, and any abnormalities were noted.
Thanks for watching.
And learning about the nervous system. So Tessa, I heard there's some disorders. Dang. So Tessa, I heard there's some. Dang. So Tessa, do you know any disorders of the nerve system? So Tessa, I heard there's some disorders of the nervous system. Do you know any?
Yes, Bell's palsy is a form of. Oh my god, I can't pronounce this word. Okay, let's do this.
Sucks. Oh my gosh. Are you standing up? Oh, okay.
Parkinson's disease is
And then there's cessation, which is a common condition arising from degeneration. No, it's not.
Why are you doing that? The nervous system is the master. Oh gosh. Thanks for watching.
And learning about the nerve impulses of the nervous system. You know what? I messed that up.
Yeah.
If I heard you, I was going to